Introducing the innovative Implant Technologies Implant Guiding System. This fully autoclavable tray is comprised of the following elements. Measuring blades. These are color-coded for easy differentiation. The blades will allow the placement of implants of any diameter with a constant distance of 3 millimeters between implants and a variable distance of 2 or 3 millimeters between implants and natural teeth. The measuring pins can be used to confirm that the measurements obtained with a surgical stent have the minimum adequate distance for the good prognosis of the case. The diameter in the center of the pin matches the implant diameter. The longest arm of the pin is used to determine the correct position for a second implant. With the 2 and 3 millimeter extensions, the correct distance between implants and teeth can be measured. The 3 millimeter extension is used to measure distance between implants. The parallel pins serve as a complement of the measuring pins and are used to verify the distance between implants. Surgical technique. Expose the bone using either a flap or flapless technique. Choose size of blade by approximating to the diameter of implant. Slide blade into handle following the safety latch. Rotate blade into lock position. Always present the blade through the buckle aspect. If the selected blade is not adequate for the edentulous space, select a different blade. Slide desired blade into edentulous space, verifying a snug fit. Proper insertion will be achieved when lateral extensions touch the vestibular faces of adjacent teeth. Utilize your initial drill to mark implant location through hole in blade. The blade is only used to guide the positioning of the implant and should be removed once the bone is marked. Ideal mesiodistal and buccolingual location, as well as implant diameter, will provide desired aesthetic and functional outcomes. By utilizing this system, you will assure implant location 2 to 3 millimeters mesiodistally with respect to adjacent teeth and 1 millimeter inside of the vestibular faces, approximately to the level of the dentin enamel junction. To place 2 implants between 2 natural teeth, use the area of the measuring blade with 2 perforations. The bone is marked through both perforations. A constant distance of 3 millimeters is obtained between the implants and a variable distance of 2 or 3 millimeters between the implants and natural teeth. The mark will also be 1 millimeter indented from the vestibular faces of adjacent teeth. By utilizing the measuring pins, the measurements obtained with the surgical stent can be confirmed. Insert measuring pin with extensions into 2 mm hole. Rotate measuring pin to verify distance to adjacent teeth. 2 mm and 3 mm wings will verify proper interdental spacing is achievable. Rotate the measuring pin toward the second mark, and with the longest arm, determine if the second mark has the adequate distance from the first mark. Once the correct distance is confirmed, proceed to the second perforation following the parallelism of the pin. If considered necessary, distance and parallelism between both perforations can be confirmed with a parallel pin. With this procedure, we are guaranteeing at an early stage of the surgery that implants will have the correct distance between them and with respect to adjacent teeth. The guiding system will ensure correct buccolingual and mesiodistal implant location while also helping determine the optimal implant diameter during placement.